Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith-Rogers. On January 8th, HBO launches a new season of its acclaimed medical drama, The Pitt. Among those eagerly awaiting the premiere is Dr. Emily Boss, a head and neck surgeon at Johns Hopkins. She joins Dr. Josh Sharfstein to talk about the lessons of the show for hospital management, medical training, and health communication. Also, she shares who her dream guest star would be. Let's listen.
Dr. Emily Boss, thanks so much for joining me again on Public Health on Call, in this case to talk about a TV show, The Pitt.
Yes, thanks, Josh, for having me.
So I have a confession to make. I have not seen The Pitt. I was in training during the days of ER, and it cut a little bit too close to home to watch a show about medicine, and now it triggers all kinds of memories for me. But I've been hearing a lot of good things about this particular show. I read an article that you wrote about it, and I thought I would reach out. Tell me about your relationship to The Pitt.
I can start by just telling you about my relationship to television, which is that I love it. And I grew up watching ER and Chicago Hope and Doogie Howser, and I was training when Grey's Anatomy was really hot. And I had a slide once that had Abby Lockhart from ER and Miranda Bailey from Grey's Anatomy and my mother, and I'd call it the three most important women in my life. I mean, my mother would really understand every moment of medical training and hospital politics through Grey's Anatomy and ER and shows like this. So I do think that the Pitt has something to it.
Well, I'm definitely talking to the right person. Did those TV shows that you watched growing up contribute to your desire to become a doctor and maybe even to your desire to become a surgeon?
Not in any way, but I do think that they contribute to how I speak to patients and family members. And they have a real way of showing how physicians or clinicians can communicate with each other and with patients and families. That's unique. You know, when we're practicing, we really only are with ourselves. After training, we don't get that opportunity to see how other people explain care and explain diagnoses to patients and families.
Got it. So maybe not the reason you became a doctor, but something that's actually helped along the way.
Absolutely. Absolutely.
Okay, so let's talk about The Pitt. Were you excited for this show? What was your initial reaction? This is a show that I understand follows 15 hours in an emergency department.
That's right. I initially watched episode 1 and I had the same reaction that you describe, and actually a lot of physicians describe when I talked to them about the show. It produced a lot of anxiety. It's really fast-paced. You see a lot of very serious cases. You know, the cases that they are showing are happening in one day are actually, many of them are once-in-a-lifetime moments, maybe very stressed out. We actually turned it off. I went back to The Pitt because it was getting so much press and because I learned that there was a patient who had a post-tonsillectomy bleed on the show. So a patient who had bleeding from the throat after they had their tonsils out. I'm a pediatric ENT. That's bread and butter for me. So I felt like I needed to go back and watch it a little bit more closely.
And so you go back, and what do you find?
So first, they had a young adult, a student who couldn't drive. Parents were out of town, who had bleeding after tonsillectomy. It had chronic tonsillitis, and he came in and was having severe hemorrhage. And the clinical language that was used was appropriate. And actually, it was interesting to me, Noah Wiley, his Dr. Robbie, he's the main ER doctor, the same person who was the head actor in ER back in our day. Under his breath said, draw up nebulized tranexamic acid, which is TXA. It's a medication that helps clotting happen and helps reduce the severity of bleeding. That got me really excited. And I'll tell you why. I mean, TXA, it does help actually prevent bleeding. It helps sort of reduce the severity of bleeding, and it helps prevent patients from needing to go back to the operating room. Not all the time, and it wouldn't have probably for this patient, but it does very frequently. And it's just not automatic in any healthcare system, even in ours. We've just recently gotten a pathway developed that integrates with our electronic medical record so that if a patient like that presented to somebody who wasn't familiar with this problem, they would be directed to the appropriate care. But it's just not automatic across the board in so many different hospitals, health systems. So it got me excited about something that we can do better in healthcare.
Got it. I think you're probably the 0.01% of viewers who had that reaction to that particular scene, but it illustrates that TV shows can represent needs in the real world. What did you think about the portrayal of the staff and the struggles that they have?
The staff dynamics hit home for me quite a bit. There were a few dynamics between male physicians and female physicians, and in both dynamics, they were more senior men talking to more junior women, and there was a little bit of a shaming, not actually a little bit, there was a shaming dynamic that occurred. In one instance, it was very significant. There's a senior resident that is telling an intern or junior resident that she's either stupid or arrogant, but has only been a doctor for 90 days and needs to shut up and listen and learn, and is very vocal about it. And you watch as the room around her is silent, and it takes the lead doctor to come and grab him and remove him from the scene to talk to him and intervene. But I wish I could say that doesn't happen. Surgery is always seen as the whole historic surgeon throwing instruments and being angry in the operating room. I don't think that in particular happens, but I do think that we have probably more of these anger or shaming dynamics than we should in medicine now. And so that was triggering to me.
Should that scene be required viewing for senior physicians, particularly male physicians these days?
Well, it should be required viewing for anybody. I mean, we talk a lot about if we're in a circumstance such as that one, anyone in the room should feel free to speak up. But in reality, it's really hard to. And you actually see that with the other trainees and nurses that are in the room when that exchange occurs. It's very hard to challenge authority or speak up in the moment. And these instances also can affect patient care. And everybody's stunned, you become distracted, you start shaking, and that certainly happens more often to a lesser extent, but we do see this time and time again.
And talk to me about the portrayal of the healthcare system. I mean, I think back to ER, and it was sort of an overburdened urban emergency department with a lot of heroes overcoming obstacles, but not necessarily being ground down by them. What is the Pitt like in that regard?
They make the staff very heroic in each one of their levels. They feature this mostly emergency medicine staff and physicians, but they feature some of the nurses. They feature staff that are in the waiting room. They actually feature an administrator, and then they feature different physicians at levels of training: medical students, interns, residents, and attendings. And I think they are highlighting burnout and some of the just general exhaustion and cognitive load and stress you can have from patients and patient dynamics, and how that impacts how the doctors or the staff function with each other and with the patients. I would say that there's an instance of a doctor who misses a diagnosis because she fails to do a pelvic exam in a patient who is obese. And the implication is that she didn't do the exam because she had assumed the problem was related to the patient's obesity and not to something else. And I thought it was very interesting. It was a real. First, they chose a nice, kind, empathic female physician to be the person who has this kind of implicit bias or made this omission, and it just sort of showed that you can get really overloaded, right? And these sort of immediate decisions that we make in medicine are based on a whole host of experiences. Sometimes they may be biases or experiences that are innate or implicit to us.
You mentioned earlier that you appreciate TV shows with medical themes because it actually informs your clinical practice. Have you found that from watching The Pitt?
Yes, very much. There's a practice called perspective taking, and it's actually a known intervention for trying to reduce some of these biases that we don't even know we have in how we communicate with. So I think TV dramas or dramas like The Pitt, we have this unique opportunity where we can really see the perspective of a single physician through the journey of their day or a single patient. So for example, the physician who may have missed a diagnosis or may have missed a diagnosis because of the way a patient looks, we got that physician's personality and the stressors that physician had in the hour prior to her going to treat that patient. And so I think that allows a little bit of this unique opportunity to see the window of how somebody's day is going when they're providing care.
Dr. Boss, the second season of The Pitt is around the corner. Are there any ENT, ear, nose, and throat cases that you think would be good for this show?
Well, the show has done a good job in that we've seen a few cases. We saw one case where there was an emergent cricothyrotomy where somebody had to put an airway in a neck because they had facial fractures. And of course, they had this very severe post-tonsillectomy bleed. But I'd love to see some humanity of the ENT physicians displayed a little bit more. The scene that I reflected on about tonsillectomy, they showed the intern calling the head and neck surgeon, and the head and neck surgeon told them that they're not going to take care of another hospital's problem to put the patient in an Uber. So I'd like for my specialty of mostly really wonderful physicians to be redeemed in that regard. But in general, I like seeing all these different systems issues at play, and I'm excited to watch more of them.
Is there one storyline that you're particularly interested in seeing how it resolves?
Well, I said before I was really triggered by the argument between the man and the woman, and so I'm curious to see how that is remediated, and actually I'm curious to see if they have that physician be more openly accountable to a scenario like the one that we witnessed.
That sounds interesting. I don't know whether it's going to be enough to give me the interest in tuning in again, but maybe. This has been a great conversation. Last question. Any guest stars you're hoping show up in season 2?
Juliana Margulies, of course. She's my hero. I loved her so much from ER, and I loved her in The Good Wife. So let's hope she comes back.
Dr. Boss, thanks so much for talking to us today.
Thank you, Josh.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Rachel Walsh. Audio production by Michael Bonfils, Matthew Martin, and Philip Porter, with support from J.B. Arbogast, Spencer Greer, and Chip Hickey. Distribution and social media by Rachel Walsh, with support from Nick Moran and Brianna Iacovelli. Follow us on Instagram and Blue Sky at Public Health Pod for more public health takes and special content. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.